Welcome to another video. This video includes 10 nursing practice questions to teach you how to master the NCLEX. At the end of the video, check out the description for studying resources and more. Practicing nursing questions frequently is the best way to pass many nursing exams. Now let's begin. Starting with question 1. A client returned to the unit following a pneumonectomy. As the nurse is assessing her incision, she notices fresh blood on the dressing. The nurse should first reinforce the dressing. Continue to monitor the dressing. Notify the physician. Note the time and amount of blood. The correct answer is notify the physician. The physician should be notified immediately, because if the bleeding persists, the client may have to be taken back to surgery. A client had a transurethral resection of the prostate yesterday. He is concerned about the small amount of blood that is still in his urine. The nurse explains that the blood in his urine should not be there on the second day. Will stop when the Foley catheter is removed. Is normal and he need not be concerned about it. Can be removed by irrigating the bladder. The correct answer is it is normal and he need not be concerned about it. Some hematuria is usual for several days after surgery. The client should not be concerned about it unless it increases. A client has returned to the unit from the recovery room after having a thyroidectomy. The nurse knows that a major complication after a thyroidectomy is respiratory obstruction, hypercalcemia, fistula formation, myxedema. The correct answer is respiratory obstruction. Respiratory obstruction due to edema of the glottis, bilateral laryngeal nerve damage, or tracheal compression from hemorrhage is a major complication after a thyroidectomy. A mother who is breastfeeding her newborn asks the RN, "How can I express milk from my breasts manually?" The RN tells her that the correct method for manual milk expression includes using the thumb and the index finger to alternately compress and release each nipple. Roll the nipple and gently pull the nipple forward. Slide the thumb and index finger forward from the outer border of the areola toward the end of the nipple. Compress and release each breast at the outer border of the areola. The correct answer is compress and release each breast at the outer border of the areola. The best method to express milk from the breast is to position the thumb and index finger at the outer border of the areola and compress. This is the location of the milk sinuses. The client has been in active labor for the last 12 hours. During the last 3 hours, labor has been augmented with oxytocin because of hypoactive uterine contractions. Her physician assesses her cervix as 95% effaced, 8 centimeters dilated, and the fetus is at 0 station. Her oral temperature is 100.2 Fahrenheit at this time. The physician orders that she be prepared for a cesarean delivery. In preparing the client for the cesarean delivery, which one of the following physician's orders should the RN question? Administer meperidine, Demerol, 100 mg IM 1 hour prior to the delivery. Discontinue the oxytocin infusion. Insert an indwelling Foley catheter prior to delivery. Prepare abdominal area from below the nipples to below the symphysis pubis area. The correct answer is administer meperidine, Demerol, 100 mg IM 1 hour prior to the delivery. Meperidine is a narcotic analgesic medication that crosses the placental barrier and reaches the fetus, causing respiratory depression in the fetus. A narcotic medication should never be included in the preoperative order for a cesarean delivery. At 38 weeks gestation, a client is in active labor. She is using her Lamaze breathing techniques. The RN is coaching her breathing and encouraging her to relax and work with her contractions. Which one of the following complaints by the client will alert the RN that she is beginning to hyperventilate with her breathing? I am cold. I have a backache. I feel dizzy. I am nauseous. The correct answer is I feel dizzy. Dizziness is the first symptom of hyperventilation. It occurs because the body is eliminating too much carbon dioxide. A client calls the prenatal clinic to schedule an appointment. She states she has missed 3 menstrual periods and thinks she might be pregnant. During her first visit to the prenatal clinic, it is confirmed that she is pregnant. The registered nurse learns that her last menstrual period began on June 10th. According to NCLEX rule, the estimated date of confinement is March 17th, June 3rd, August 30th, January 10th. The correct answer is March 17th. Using NCLEX rule, count back 3 calendar months from the first day of the last menstrual period. The answer is March 10th. Then add 7 days in 1 year, which would be March 17th of the following year. Assessment of severe depression in a client reveals feelings of hopelessness, worthlessness, inability to feel pleasure, sleep, psychomotor, and nutritional alterations, delusional thinking, negative view of self, and feelings of abandonment. These clinical features of the client's depression alert the nurse to prioritize problems and care by addressing which of the following problems first. Nutritional status. Impaired thinking. Possible harm to self. Rest and activity impairment. The correct answer is possible harm to self. Possible harm to self, as with suicidal ideation, a suicide plan, means to execute plan, and/or overt gestures or an attempt must be addressed as an immediate concern and safety measures implemented appropriate to the risk of suicide. Which one of the following is considered a reliable indicator for assessing the adequacy of fluid resuscitation in a 3-year-old child who suffered partial and full thickness burns to 25% of her body? Urine output. Edema. Hypertension. Bulging fontanelle. The correct answer is urine output. Urinary output is a reliable indicator of renal perfusion, which in turn indicates that fluid resuscitation is adequate. IV fluids are adjusted based on the urinary output of the child during fluid resuscitation. A mother frantically calls the emergency room asking what to do about her 3-year-old girl who was found eating pills out of a bottle in the medicine cabinet. The ER nurse tells the mother to give the child 15 milliliter of syrup of ipecac. Give the child 10 milliliter of syrup of ipecac with a sip of water. Give the child 1 cup of water to induce vomiting. Bring the child to the ER immediately. The correct answer is bring the child to the ER immediately. Vomiting should never be induced in an unconscious client because of the risk of aspiration. Well, that's it with this video. See you next week for another set of questions. Leave a comment saying how many you got correct.